In this video, I want to talk about one of the most common things that we talk about in our clinics, which is knee pain when you're on the stairs. I want to talk about why this even happens, but more importantly, the three things that we always talk about that you should be addressing in order to get rid of that knee pain on the stairs. So let's go. Thanks for checking out the channel. My name's John, head therapist here at John W Sports Injury. If you're new to our channel, well, welcome along. Thanks for checking us out, and why not subscribe? Here at the channel, we want to keep you updated on tips so you can simply understand your body, you can remove your pains in order to achieve those sport, exercise, and fitness goals. But today we're going to be talking about one really simple goal, and that is how we can improve knee pain when we're going up and down the stairs. Now, this is a super common issue, something that we're asked about probably daily. So why is this happening? Why are we getting this knee pain on the stairs? We might be getting pain across the top of the knee. We might feel clicking, grinding as we're walking up, and even more so down the stairs, which is something that often surprises people. But I want to explain why and then dive into those three tips that you need to be thinking about in order to stop that. So why is it happening? Well, we have big, powerful muscles crossing over the top of the knee joint. We have the quadriceps at the front and the hamstrings at the back. And you can see, for example, this tendon coming over the top of the kneecap here, which is called our patella tendon, which is the tendon for the quads. Now, put simply, when we're working those stairs, we're going through lots of flexion and extension at the knee, lots of movement happening at the knee. So if we have dysfunction in these structures, staircases can really highlight those problems with the knee because we put lots of load through it. Why when we're going down? Well, when we're going down, the muscles at the front called our quadriceps have to decelerate or break us. We call this an eccentric muscle contraction. And this is the most kind of difficult way for muscles to work. So when you're walking down the stairs, you're really loading those muscles that cross the top of the knee joint. And as a result, that can really highlight some of your pain. So what I want to do now is dive into my three tips that if you are experiencing this knee pain, how you can help yourself out. Tip number one is to concentrate on the flexibility around that knee joint. So I mentioned that we've got some of these powerful muscles, and I want you to focus on three main areas: the quadriceps, the hamstrings, and your glute muscles, the big muscles that surround the hip. So what we need to do first of all is understand if they're tight in the first place. And the bonus is that the test that we're going to talk through can then be a stretch that you can be doing daily for 30 seconds in order to improve that flexibility. So probably the most direct muscle group to be impacted on the knees are the quadriceps. So the quadriceps run in the front thigh area. In order to test these, first of all, to see if they're tight in the first place, we do what we call an Eli's test. In order to do this, you simply lay on your front, keep your hips flat on the floor, and you look to pull one of your heels up towards your bottom. You can then grab that with your wrist and look to pull that in. Now, what we should be finding here is that we can comfortably keep our pelvis on the floor, bring our foot so it touches our bottom. But can you find that you can't do that, or you get some soreness, some cramping? That's telling us that there's some quadricep or thigh dysfunction happening and you're a little bit tight in this area. But as I mentioned, all of these tests can then be used as a stretch. So this is something that you can incorporate into your daily stretching routine. But people often find this stretch to be a little bit difficult. Not a problem, because you can turn onto your side and do a modified quad stretch where, again, what we're looking to do is start this time by bringing the knee closer up towards the chest, then pull the foot to touch the bottom, and then try and bring your knee to be back in line so that you end up in a similar position, but by laying on your side, it's a little bit easier to get into that position. Then you can return at a later date, once your flexibility is improved, to do the full stretch where you're lying on your front. Secondly, we want to be working the flexibility of our hamstring muscles. These are the muscles that live on the back of the knee, the back of the thigh, and they come down and cross the back of the knee. In order to test these to see if we're tight, we do a straight leg raise. What we're looking to do here is to lay flat on our back. And then what we want to do, keeping our leg deadly straight, which is the important factor here that we often get wrong, lift that leg slowly up. So what we're looking to do here is, can we bring that leg to a 90-degree position? You'll start to feel the pull in the back of your leg. And if this prevents you, whilst keeping a straight leg, from getting that leg to straight, then what we might be finding here is that we've got a tightness in our hamstring muscles. So again, this is a stretch that we can easily do in our daily routine, holding these stretches for 30 seconds, and over time, you're going to see your hamstring flexibility improve. If you do find this stretch to be particularly difficult, you can use something like a cord, a dressing gown cord, or a band or a towel to help pull that leg up. But remember guys, really important that we're keeping that leg deadly straight, because as soon as you bend that leg, you're taking those hamstrings off stretch and you're cheating a little bit. Finally, the glute muscles are muscles that we want to be checking out. These are ones that I talk about all the time. I often call them the big bullies. They're our biggest, most powerful muscle, but they can commonly cause dysfunction. And if they're not working correctly, then knee pain is a common result as a result of that. And this, as I mentioned, will be greatly highlighted when using the stairs. So we want to be checking out the flexibility. I call this a figure 4 test. What you want to be doing for this one is laying on your back. You can bend one leg so you keep the foot on the floor and the leg is bent. With the other leg, take that foot and place that onto the thigh. So you form this kind of modified 4-shaped position or figure 4 position. The foot that you have moved on top of the thigh is the side that we're going to be stretching. But with the other leg now, what you want to be doing is lifting that knee up towards your chest. And you'll start to feel in that figure 4 leg, if you like, the hip area or the glute muscles being stretched. Now, how can we tell how flexible we are? Well, we should be able to take the lifting leg to about 90 degrees. So similar to the hamstring position, we want to get 90 degrees of hip flexion. So if, for example, you're stretching your right leg, the left leg should be able to lift that right leg so that you're in a 90-degree position. If not, if you feel those legs wanting to push back because the glutes are getting tight, there's your indicator that you have some tight glutes. And that's an area that you can look to address with that stretch. So take that test position and hold that for 30 seconds. Again, when we're not testing, when we're stretching, something that you can do to make this stretch easier is to loop your hands in between that lifting leg, wrap around that lifting leg and help to pull that further into what we call a passive stretch. So that's my first tip, which is to work on the flexibility around the muscles that are directly impacting upon the knee to see that we can make those as flexible as possible, and therefore we're not creating excessive pressure onto that knee. Secondly, we want to be looking at the strength around the knee. Now, I often talk about how a knee is a joint that gets bad press. It gets beaten up by other areas. What we want to be making sure is that the knee is stable enough to perform that function of being tested as we walk up and down the stairs. And this really, a lot of the time, comes down to the hip. The hip, as I mentioned earlier, has our glute muscles. These are our biggest, most powerful muscles, really there to stabilize the lower limb. So what we want to be doing is making sure that these are strong. So firstly, how do we test whether the knee is being controlled correctly by the hip? Well, we can do something that we call a single leg squat. What we want to be doing here is standing onto one leg and looking to bend down into a squat position on that single leg. What are we looking for here? Well, the crucial thing is the position of this kneecap. Now, with the kneecap, you should see that just moving straight up and down. But if we have an issue where we're unable to control that kneecap that well, what you'll see perhaps is the kneecap deviate from that centralized position or commonly dropping over that big toe. So if you find that you can't get to the bottom of that squat without that knee dropping in, that's an indicator that we might have some tightness in the, lack of strength, guys, in the hip area. So this is something that we want to work, because if we're then walking down the stairs and we have to step onto one leg and have that stability, if it's not there, the knee's going to drop in, and that's what we call poor patellar tracking, and that's going to aggravate your pain. So if you're finding that you can't do that single leg squat without that kneecap dropping in, we need to get to work on strengthening those glutes. Now, this might not even be a glute strength issue, but a glute recruitment issue, because sometimes our glutes can be lazy. So we want to fire up those glutes, get them stronger, get them working better. There's many exercises that we can do around this, but some are nice and easy to do laying around watching the TV, which in truth are my favorite type of exercises because it's easy to keep up the progress. So one of the exercises is what we call a clam. Now, in order to work a clam, we lay on our side and we bring our legs into a sort of 45-degree position. Now, we want to keep the ankles in contact with each other, but the movement happens when we bring our knee away from the other knee. And as we go through 12 repetitions of this, you'll start to feel those glute muscles working. And we're looking to do 3 sets of each of these exercises for 12 repetitions. So that's our probably most basic exercise. The next exercise we can do is what we call wiper, or I call a wiper, I should say. I think I might have personally titled this one, but I'm not sure. Don't hold me to that. But what we're looking to do here is to lay on our side and keep our legs nice and straight. And what we're looking to do here is simply bring the one leg, the top leg, away from the other leg, and then slowly control that on the way down. And again, that's our important movement. We talked about these eccentric muscle contractions or these decelerations. Keep that movement nice and slow as it comes back down to meet the other leg. Reminder, we're looking to do 12 of these exercises, 3 sets. But if you're finding that you're not able to get to this position, or this number of repetitions because the muscles start getting tight or cramping, that's absolutely fine. But again, it's an indicator that we could get stronger in the area. So take a mental or physical note of what repetition you're getting to, and then just work within your pain zone. But hopefully over time, this number starts to increase and develop as you move towards 3 sets of 12. Finally, one of my other favorite exercises in terms of strengthening our glute muscles is what I call a weeing dog. And I always apologize for this name, but I like the name because you'll definitely remember the exercise. And for this exercise, we go onto our hands and knees, and all we're looking to do is to bring the leg away from that resting position. So we should be in a 4-point kneel, bring the knee away, and you'll start to feel those hip muscles really working in there. Again, aiming for 3 sets of 12 if pain allows. And finally, if all of those you're saying to me, John, these are too easy for me, then we go back to our original thinking of the test exercise is a good exercise to be achieving our goals. So we have the single leg squat where we're looking to fire those glute muscles. So what's my third and final tip? Well, this one really comes around just looking after the quality of the muscle tissue. And here we start to talk about massage or rolling. And in fact, for the thigh area or the knee pain around the stairs, I tend to find something like using a massage stick or a rolling pin to be a really helpful tool. And again, it's stuff that can be done by sitting watching the TV. So you can't be making the excuses that we don't have time, because I know that most people find the time to watch the TV regularly. So by using a massage stick, just rolling through the tissue, and what you're looking to find here are those sore points. I always say to people that functional, healthy tissue doesn't hurt. So if you're rolling onto something and it's feeling sore, that's an area of attention that we want to be placing extra emphasis on. So find those areas, simply look to roll them out. Imagine these thigh muscles coming down over the top of the knee being like a lump of dough. And what we're looking to do is we want to make that dough more pliable, like we would do if we were looking to cook with that dough. We want to make it more efficient, and that's what the rolling will do for you. So I hope that's helpful for you. As you say, if you're sitting there frustrated by the knee pain that you're getting on the stairs, it's really common. Probably one of the most common things that we talk about in our clinic. But to reiterate, my 3 tips that you should be working on are: make sure the flexibility of the muscles that are directly impacting over the knee are nice and flexible, and we've got no issues there. Very common to be tight in those areas, but regular stretching will help to improve that. Make sure that the hip muscles, the glute muscles are firing to give your knee that stability. Don't just blame the knee, look further afield. So go through those sets of exercises, and with exercises, I would recommend that we're doing that strength work every other day. Give yourself a day off in between to see how things have settled down and that we haven't over pushed it. And finally, look to preserve the quality of the muscle. Use things like a massage stick, or you can use something that I always talk about, which is a lacrosse ball, to make sure that we're rolling through and keeping that area as comfortable, as desensitized, as pain-free as possible. I hope that helps. If it helps, guys, why not hit that like button, because that's showing me that this is the type of stuff that you guys want to be seeing. And also, why not subscribe to our channel? Because I'm going to keep you updated on content just like this. And in fact, here's another video which I think is going to be helpful for you. But I'll see you on the next one.